The U.S. Department of Health and Human Services and U.S. Department of Agriculture released new dietary guidelines yesterday. The latest update will include images of an inverted pyramid that puts meats and vegetables in the widest part at the top, along with dairy and healthy fats. HHS also suggests consuming less sugar. The new guidelines also include changes to how much alcohol is recommended. New at 10, Nolan Wick has you covered with more on a UW School of Medicine professor's concerns.
New health guidelines from the federal government are changing how doctors talk about alcohol and diet. A UW School of Medicine professor says the new advice to limit alcohol is too vague for patients. Noel Locanti, an associate professor of medicine at the University of Wisconsin-Madison, says the old guidelines were clear. 1 drink a day for women, 2 for men. Now, she says the lack of specific limits makes it harder for people to understand.
Just as someone who works with patients every day, it's very hard to operationalize drink less than what, it's such a relative term that what's going to happen is people are just going to tune it out.
She says Wisconsin is among the highest binge drinking states. The U.S. Surgeon General released an advisory last year stating higher alcohol consumption increases the risk of developing at least 7 types of cancer. Locanti says not consuming alcohol at all is the safest thing to do to avoid the cancer risk, regardless of the latest guidelines.
We would recommend for people ideally 1 a day or less for everybody, men and women. And no, not drinking, Monday to Friday, so you could have 6 on Saturday kind of thing. So there's both a daily and a weekly limit. That would be what we would want to see from a cancer perspective.
Additionally, Locanti is concerned that vague guidelines could increase alcohol-related cancer cases.
We're also concerned about the trends in alcohol consumption since COVID. And in Wisconsin, we're really concerned about alcohol consumption. And so being as clear as possible when we communicate to the public about the harms of alcohol would be in everybody's benefit.
Locanti encourages everyone to be aware of the risks of consuming alcohol and its ties to cancer.